two speakers here that should be very attuned to all of the issues. And I think what we'll do is I'll introduce the two of them, and Mr. Ayers will speak first, and then Senator Favola will speak afterwards, and then after they've both spoken, we can entertain questions. Let me start off with the introduction. Start off with Senator Favola. Senator Barbara A. Favola represents Virginia's 31st district, which includes part of Arlington and Fairfax counties and a portion of Loudoun County. She served on the Arlington County Board for 14 years and chaired that body 3 times. During her service with the county, Senator Favola was on the board's leading advocate for children, youth, and families, and her contributions to the community included establishing mental health services in the public schools. In the Virginia Senate, Senator Favola has focusing her legislative efforts on health care access, K-12 education funding, workforce training, safety net programs, helping foster children, preventing domestic violence, and sensible environmental policies. Senator Favola serves on the Virginia Senate Local Government Committee, Rehabilitation and Social Services Committee, and Transportation Committee. She is chair of the Virginia Advisory Committee for Sexual and Domestic Violence and recently chaired Virginia's Commission on Youth. Senator Favola was recently appointed to the Disability Commission and in the Joint Committee to study the future of public education. Senator Favola serves on the Advisory Board of Virginia Tech School of Public and International Studies. Prior to the Senator Favola's elected life, she served as the Presidential Management Intern and Senior Policy Advisor at the Federal Department of Health and Human Services. She is a founder and managing director of Pathways to the 21st Century Communities, a consulting group specializing in government relations and community outreach. In addition to her Senate duties, she serves on the numerous boards and commissions, including the Advisory Committee for Arlington's YMCA and the Fairfax CASA Board. Nice set of credentials.
You read them all. I heard you say so. My goodness.
No, I think
you could have shortened it, but thank you.
For Carl Ayers, joined the Virginia Department of Social Services as the Director of Division of Family Services in 2014. The Division of Family Services is responsible for the supervision of the Child Protective Services, foster care, adoption, preventive services, interstate compact on the placement of children, interstate compact on adoption and Medicaid assistance, and Title IV-E programs for Virginia. Prior to joining the Virginia Department of Social Services, Carl had a number of positions with local departments of social services. Most recently, he served as the director of the Favola County Department of Social Services from 2004 to 2014. He has more than 22 years of experience in the child welfare system. Throughout his distinguished career, he has held numerous leadership positions at the local, state, and national levels. He has led Virginia's statewide study involving substance abuse, substance exposure infants, with a focus on how Virginia can improve its response to children and families impacted by substance abuse. He currently leads Virginia's 3-branch initiatives to implement the Family First Prevention Services Act and previous initiatives to reduce child fatalities. Carl serves as the chair of the Interagency Partnership to Prevent and End Youth Homelessness for the Commonwealth of Virginia. He's on the Executive Committee of the National Association of Public Child Welfare Administrators and is on the board of the Child Welfare League of America. I thank both of them for coming here to give this presentation. You can either do it from your chairs or up here. We'll start off with Mr. Ayers.
Okay. Thank you, and good morning, and thank you for the opportunity to be here. I had the opportunity to serve on the Health and Human Services Committee for VACo for
I chaired it for 5 years.
So that's where we first got to know each other back here in the years that I was a local director and served as our president of the Virginia League of Social Service Executives, so your local directors and the Board of Social Services. So certainly my pleasure to be able to come back and talk with you a little bit about things that are going on. What I've given you in your packet is the Family First Prevention Services Act. This is really for you to have something to take away and go back and for a conversation. I want to talk with you about this, and then going to connect it with the work that has been being done inside the General Assembly, inside of the state itself, and then certainly then going to turn it over and let Senator Favola talk with you about how the Commission on Youth is taking the work that they've been doing in foster care movement through that direction. So I'm going to talk with you a little bit about several different things going on at the federal level, the state level, and then how we're looking at improving our foster care system in Virginia. One thing I think it's really important for everyone to understand, when you think about the outcomes for our children and families that are served in the foster care system, it's that they have been relatively unchanged since 2003. So we had our first, what's called a Child and Family Service Review in 2003. The last one we had was in 2017. If you overlay those reports for each other, in Virginia we have been very consistent with our lack of improvement in outcomes. I won't use the negative way that we can think about that, but we really have a lot of work to do, and we have a ton of work really to do around how do we support children and their families inside of their communities. And so what you're seeing, what you're going to hear with Family First Prevention Services Act, is it really from the federal level, for the first time, has pushed us into the direction of how do we move much more in a supportive nature of our children and families, and less of thinking that taking children out of the home and placing them in the foster care are going to fix the societal issues that we are looking at. And so that's what you're going to hear, and then hear some of the tie-in from that and others. I will tell you, when we get into the JLARC conversation, JLARC had a set of 34 recommendations. So whenever you think about where we've got to go, it's a long way and a lot of movement whenever we think about where we're going to go with our system. So just some basics before we get into this. The first thing I will tell you is, for any of you, and I don't know how many of you have worked in the child welfare field, but understand the history of child welfare came out of a need to protect children. And believe it or not, the first laws that protected children were based off of laws to protect animals. So we had laws to protect animals before we did children, because children were seen as property. And so whenever you think about our child welfare system and why our child welfare system exists and how it was developed as a mechanism to ensure the safety of children after a report of abuse or neglect has happened. So it's really important to understand that the child welfare system in and of itself is not a proactive system. It's not meant to protect children from being abused or neglected, to set things up, to put children in the right path, put families in the right path. It is a reactive system. And if you actually go into our code, you have to have a valid report of abuse and neglect happening to a child before we even have the authority to respond to that family. So it's really important to understand that that is where child welfare was developed and how it works. So whenever people say, well, why will the child welfare system function this way? Why does it move this direction? Well, it was designed in that direction. And so when we think about what are some of the key things looking at the Family First Prevention Services Act, is that we have to ensure children are safe. The second major thing from that piece of it is we have to strengthen families. And whenever I say strengthening families, that means dealing with the degradation of the family, dealing with substance abuse, dealing with mental health issues, those sorts of things that have really impacted child welfare. There's been a huge hit and look at the opioid issue over the last several years. But inside of child welfare, opioids are just the most recent epidemic to hit the child welfare system. It's certainly not the newest one, and so there in my career, I can actually track you back to the crack epidemic in the mid to late 90s and take you through multiple different epidemics. And so what we've got to look at is how do we support families, how do we deal with the treatment of families that are really dealing with mental health and substance abuse issues, and so that they can help to raise children that are going to be healthy and be able to be productive citizens as they grow. And then the last piece of it is the act itself is encouraging us as states, and it's encouraging us to do that through the use of money. So each one of you sit on boards of supervisors at your local government. You know, money drives a whole bunch of different things. And so the federal government is trying to drive practice by reducing the amount of funding that they're going to give us on the congregate care system. And how they're doing that is trying to move that funding for the first time ever in helping to prevent children from coming into the foster care system for the immigrant. And so this is a really complicated act. It's the largest change to Title 4E, which is our major federal funding source in child welfare, in 40 years. So do not misunderstand how big of an impact this act means and what it looks like for our child welfare system. So what I will tell you as I sit here today, this act, I was notified on February 7th, 2018. And for any of you that were following the federal government at that time, they were going through a series of, are we going to stay open or are we going to shut down? We want to stay open or we want to shut down? And so on February 7th, it was a Wednesday. I got a call from some of my federal partners and said, the president's going to sign a major spending bill on Friday, which is February 9th, and Family First is going to be included in that spending bill. I literally had 2 days notice as a state director to understand what this was going to look like. Since that time, the federal government has put out 2 major clarifications for this act. This act is over 100 pages of federal law. And so to try to understand how broad this act is and everything, the federal government has been very slow in providing direction to us as a state, and it basically said it's up to you as a state to figure out what this is going to look like and to figure out how you're going to move your system. And so as I talk through this with you, I want to talk with you about the decisions the state has made, about what does this look like, and about the approach that we have taken. The approach that we're taking, this 3-branch institute model that we are taking, is a national model that I've been around the country teaching others how to use this model. And it involves roughly about 130 individuals. The vast majority of them are local providers, local governments, and entities along those lines that are here helping us do this. And so it's really important to understand that this is not a state-down type conversation. This is very much what does this look like from a community and how do we make these changes. So this act is broken into 2 major pieces I want to talk with you about this morning. One of them is prevention. The second one is congregate care change. For any of you that have the pleasure of running CSA budgets, every one of you that sit in here, if you're on board, you get the pleasure of keeping up with CSA. Virginia is the only state that has CSA. We are the only state in the nation that the government decided to take the foster care dollars out of the foster care agency and put them into a separate agency. So if you go back to the history of 1993 when CSA was created, we're the only state that operates this way. So what I tell people is the federal government did not think about Virginia when they wrote Family First. So they were not thinking about what does the system look like, how does it function, and so we've got a very unique setup whenever we start thinking about this. So all of the foster care dollars, including foster care prevention services, sit inside of your CSA budget. And I'm going to talk with you a little bit about your match rates and what that looks like so you fully understand the implications of how these monies flow. What I'll also tell you is that on the congregate care side of this, is you really have to understand not only the CSA match rate, but you have to understand 4E, and you have to understand Medicaid. So let's make this even more complicated on you to try to understand what is the fiscal impact going to be. What I'll also tell you is this is over $600 million between 4E and CSA we're talking about. So these are major, massive amounts of money that we're trying to figure out how to set the best structure in place to help people run. So on the prevention side of things, whenever we go live with this, whenever we make a decision to run, we have to go live by October 1st of 2021. The changes go into effect, period, end of discussion by October 1st of 2021. We can go live as early as we want to, and so we could have went as live as early as October 1st of this year. However, what happens is the prevention opportunities you see here are going to be offset by the congregate care changes that you see. The act was drafted to be budget neutral. And if you follow the federal law, what that means is that they're just shifting the pie around. The pie is not getting any bigger. It's not meant to do anything else other than to be budget neutral. So you're going to save money on the prevention side of it, and they're going to create that savings by taking money out of the congregate care side of it. So that's really how this act was drafted. So who is eligible? This is a child and their caregivers. So this is really important to understand in the research inside of the child welfare system. has shown that two-generation approaches or multi-generation approaches are the ones that have the best impacts of bringing families out of the generational cycle of abuse and neglect. What that means is that you do not just provide services to the child. You provide services to the child and their caregivers simultaneously, and that is what moves the child and the family off this generational cycle of abuse and neglect. So this act allows 4E's to be eligible to pay for services to the child and to their caregivers and to their kinship families. So if this is a grandmother, a grandfather, an aunt, and uncle, they can be eligible for services the same way that the child is eligible for services. That is really important as we know the number of grandparents and aunts and uncles that are raising family members today. That is a really important aspect of this act. The second ones are major ones that I'm not going to spend a lot of time getting into with you, but a child who is in foster care that's pregnant or parenting, the research shows that the vast majority of the time, that child that's in foster care is going to come in foster care. In this situation, the cycle just perpetuates itself. So this is an attempt to try to break that cycle. And then the child whose adoption or guardianship is at risk of disruption. That doesn't matter as much to you as it does to me. We have services to prevent adoptions from being disrupting, but they are 100% state funds. By being able to match them with federal 4E funds, that is a 50-50 match. So whenever I'm spending $130 million a year on adoption services, to be able to match some of those with federal money that I've not been able to match makes a huge difference when we think about what does the Act do for us. In addition to that, so the family can be eligible for services, but for the first time ever, the federal government is saying that if you're going to use money, you have to use money on programs that are shown to work. And so they created this piece that's called a clearinghouse. And so in order to purchase a program, the program has to be evidence-based, and the program has to be listed on this federal clearinghouse. And so if you look up here on the screen, this is the list of services that presently exist in the federal clearinghouse. This is the only list of services that exist in the federal clearinghouse. So we will see this clearinghouse grow over the next 8 to 10 years. And so as a system, we will continue to have more services that will be available to us, and we'll continue to have those that will be able to be purchased. However, right now, you are limited to only the ones that you see up here from this end of it. To make it even more complicated, the Act says they have to be evidence-based, they have to be listed on the clearinghouse, and 50% of all the money that we spend has to be in the well-supported arena. So those 6 programs that are over under number 1 on the left-hand side of the screen. 3 of those programs, parent-child interaction therapy, functional family therapy, and multisystemic therapy, are ones that we can get out pretty consistently across the state now. Juvenile justice, and for any of you that have been involved in juvenile justice reform, they have rolled out FFT and MST throughout the state over the last couple of years. So we're going to be able to build off of what they've already done to get that available out into many of the different communities that already exist. So we already have an infrastructure that exists. Parent-child interaction therapy is one that we partner significantly with behavioral health, with the community service boards, to be able to get that program out as widely as we can around the state as well. The 3 that you see at the bottom, nurse-family partnerships, parents as teachers, and Healthy Families America, those are all what are known as home visiting programs. Home visiting programs have the best evidence to prevent abuse and neglect, period. So if you want to talk about, you want to know what as a community provides your best opportunity for children not to be abused and neglected, it is your home visiting programs. The thing is, your home visiting programs are only available in certain parts of the state, and they are not universally available. So there's only a certain number of slots that will come. They are also not traditionally linked to abuse and neglect having to occur before a family gets into a home visiting program. So in addition to that, most of these are about 5-year programs. So they get you up into school age, and then they switch over and drop you off to the school to be able to continue services if the family needs it. That is important because this Act limits reimbursement to 12 months. So you can provide services, but it is limited to 12 months. The other complicating factor with this is these 3 programs, these home visiting programs are available. However, they do not have an infrastructure to be able to bill for you. So we're working very closely with them to set up an infrastructure that we can actually bill it. The way that they work now is they have a certain amount of money, and then they have a number of slots of families, and then they just divide those slots up by the money they have. They actually don't have a billing mechanism. And the way 4E works is you have to build a program. And so there's just some complicated infrastructure we have to put in place for that. The only supported program that exists right now is Family Space in the Future. There is one trainer nationwide that trains on Family Space in the Future. And it is a substance abuse treatment program done in combination with methadone maintenance therapy, which is a promising practice. And so we will see what the availability actually is for us to be able to do that. The last one under the promising practices are what is known as trauma-focused cognitive behavioral therapy, TFCBT. That exists, and there is at least one clinician in every single CSB that exists throughout the state. So this is one we've been investing in and working on throughout the state over the years. So this is not a new program to us. The difference is that this clearinghouse rated it as promising. Many of the clearinghouses that exist rate it as a well-supported program. And so it just impacts us and our ability to make sure we're spending 50% of that. The last piece is that we have the ability to set up kinship navigator programs. So the Act says you can set up kinship navigator programs, and actually gives us about $350,000 a year statewide to be able to do that. We have established 6 kinship navigator programs throughout the state using those $350,000. However, there's not a reimbursement mechanism right now to be able to put them under a model, because the clearinghouse did not rate either of the models. You can see the 3 models that they looked at, and then they did not rate any of those models for kinship navigator. So even though the Act allows us to be able to do that, we do not have a current model that we can actually bring to the state. And this isn't just Virginia, this is nationally. Every state has to operate off of the same challenges here. The last one is motivational interviewing. And why I share that with everyone is that is the largest substance abuse treatment in the entire nation. However, it has not been ranked. So until that is ranked, it is not something that we can bring to the state and we cannot use. It's the largest one that is used most consistently across the nation. So we are still waiting on the clearinghouse to determine whether or not they were going to rank that and where they're going to put it on the clearinghouse. Here's the next set of programs. Every 6 to 9 months or so, the clearinghouse is going to put out another set of programs. And so if you are a community that does a lot of prevention services and you do evidence-based services now, I don't know how many of you sit on CPMTs or look at your service array that exists, but if you do a lot of evidence-based services, then there will be services added to this clearinghouse every 6 to 9 months or so. Probably, given the size of the California Evidence-Based Clearinghouse, what this act was written off of, they had over 300 programs that were rated in the clearinghouse. So it's going to take years for this clearinghouse to get up to speed. So if you are working on an evidence-based program that already exists in your community, then likelihood is it's going to be on this clearinghouse at some time, even if it's not there already. What I will also tell you is if you are a community that does not do any prevention services, and only about half of the jurisdictions in the state do prevention. So there are 120 local departments of social services, 133 local CSAs. Only about half of those do any prevention services, which means you're waiting until the children come into foster care and then you're spending your money. What this is telling you is that you need to be moving upstream and looking into prevention and not waiting until after the children are removed to be able to do that. Because I'm going to explain to you financially how that is going to hit you if you're one of those communities. So what I tell every community is you need to go back and look at how your system operates, how you fund, how you use your dollars, and start thinking about how that is going to move your system. What I will also tell you is that if you are familiar with how you spend your CSA dollars, your CSA match rate for community-based services is half of what the old neutral match rate was. So I'll take you back to 2008. Under Governor Kane, First Lady Ann Holden, we had one match rate for all of CSA. And during that time, they created a series of 3 match rates. One to emphasize community-based services, which was half of what your old match rate was. And then one that we always called the penalty match rate. So if you place kids into group homes, residential facilities, you had to pay a higher match rate than that. And so what I would encourage each of you to do is make sure you really understand how you're spending your local dollars and whether you're spending a significant amount in that penalty phase or whether you're really working very closely to make sure you're maximizing community-based services. Now, I'll tell you, just as I served as chair of the CPMT for Floyd County for 10 years, and so our match rate was 23.24%. Lord knows I dealt with this so much I still remember it. So the community-based match rate was 11.67%. So that made a lot of difference for us, especially when we put kids in residential facilities, match rate's 30%. And so you can see how your numbers start to break down as a community and how if you maximize on the community-based side of it, which is where this is moving you. The last thing I will tell you is that CSA has none of these requirements in it. You don't have to spend 50% on the well-supported. You don't have to spend in these buckets from the end of it. If the family needs wraparound services and community-based, you can purchase those wraparound community-based services using that, what we call the advantageous match rate for the locality. So it's just something to make sure you understand your match rates in CSA. If you don't understand that, you just look at the dollars and go, why are we spending so much money? You really have to break it down and look at how your dollars are flowing in each of those match rates. Now, this is something that we have been pushed very hard from the local jurisdictions and from the local CSA offices and communities to do, is to try to move towards statewide contracting instead of having 133 local CSA systems do individual contracting. And so we have heard you. We are working on this. This is something that we have not done inside of the social services system. So whenever I talk about those evidence-based programs, parent-child interaction therapy, functional family therapy, multi-systemic therapy, and trauma-focused cognitive behavioral therapy, I will be releasing an RFP on behalf of the state, and then providers will be signing on to that statewide RFP. And then as a community, all you would have to do is be able to pick that provider off the statewide contract and do a purchase order with them. So it takes you out of having to have a contract with everybody and makes it a much more streamlined process. Now, I'll tell you, that's a big leap for us because it's not something that we do. So, but it's getting ready. We're in the final stages of that RFP getting ready to go on.
Is it a writing contract, and you write it, or is it just can, you know what I mean by writing,
Yep.
like as in?
Piggyback on that.
Yeah, you piggyback on it, or is it just, it's a state?
Nope. So what it is now that you use FFTV. So functional family therapy, if you're a certified provider of functional family therapy, then we're going to put out the contract and you're going to sign on and say, I'm agreeing to take whatever rate it is that we put in the contract, and I'm going to be a functional family therapy provider for, I don't know, Bath County, Allegheny, Covington, this part of the state thing. And then as the local department, the local community comes up and says, this family needs this service, I'm going to go to the contract with this provider, and then you're going to have a purchase order between there. Does that make sense? Yes, sir.
So are you concerned that you might encounter different rates or different cost structures in different areas of the state, and how will the RFP deal with that situation?
Yep, so we are not going to put it out with different structures throughout the state. We have taken all the rates and looked at the rates that Medicaid provides, looked at the rates that DJJ provides, and looked at the rates that the CSAs that are reimbursing us.
Let's try to hold the questions till both people are finished.
Okay, so we'll come back to that and talk more about it later. So this is the statewide contracting piece of it. This is a big conversation for each of you as your local jurisdictions and communities, because it's something you've pushed us massively to do as a state, to move into this and quit having each of your jurisdictions having to do a contract with each provider. So just something to get on your radar and think about. Yeah. And so for the evidence-based training, here is the trainings that we're providing. The General Assembly, we were able to work with the General Assembly and got about $850,000 last year to be able to start setting up some of these programs. And so we are offering trainings for each of these programs and providers. The application process is open now. So if you are a community that provides these trainings or wants to become certified in this, you're welcome to put in your application. We'll be doing training, so we'll be building the capacity of this each year. And so that $850,000 is in our budget, and so we'll be doing this each year for the years to come from that. So just something to think about as you say, what is the state doing to help me as a jurisdiction to do this? Here, statewide contracting, and then here, right here, we're building providers in your communities to help provide those services. And that's a really big issue, especially for our rural communities. And say, I don't have the ability to invest in this, I don't have providers. So we're trying to get you as broad of a network of providers as we can to serve those communities. So that's the prevention side of the SAC. Now I'm going to talk with you about the foster care side of the SAC. This is where people have traditionally, when you think about 4E, up until now, 4E never kicked in until the child was removed from the home. So once again, going back to that earlier conversation we had, why are families being served after the fact? Why are we always removing children from the home and getting them access to services? That's because you had to do that before the money ever kicked in. So in order to help stop some of that, they are changing some of the... Now we're just jumping around. All right, so let's think about this. So now the foster care 4E reimbursement dollars are going to be limited to 6 different placement types. One of those being foster homes, which includes your TFC homes, your therapeutic foster care. That's another avenue that I encourage jurisdictions to look at. It's one of the most costly places that jurisdictions are spending their money are in TFC. And so we've heard from a lot of jurisdictions that have been able, if they are able to just decrease 2 TFC placements each year, then they are able to fund a position to do foster home recruitment and family finding and everything along those lines. There's that much of a difference between local agency foster homes and private agency foster homes. So just for an example of our rate for a teenager in foster care is $700. If you are going the TFC route, you're going to pay $4,000 to $5,000 a month. $700 a month, $4,000 to $5,000 a month. So it's something to encourage to think about, where can I use my dollars? If you can invest in a recruiter that can build your local foster home capacity, use the same trainings and everything along those lines, and be able to build that capacity internally instead of contracting it out and paying a much higher rate. Something to think about with your fiscal responsibilities.
I'm sorry, those 2 numbers you just gave,
Sure.
just tell me again what they represent.
Sure. So we have a rate structure depending on the age of the child. We pay a rate to the foster parent depending on the age of that child. So for the maintenance rate for a child that is in foster care, if they're 13 or above, it's right around $700 a month. If you go and purchase a foster home for that same child through a TFC agency, you're going to pay, depending on what part of the state you're in, somewhere generally between $4,000 and $5,000 a month. And so it's really important to understand how that structure works. And as a community, if you figure, because I hear from communities all the time, well, I don't have foster homes, and then I don't invest in somebody to build those foster homes. Financially, you've got to be thinking about, as a community, how do you best invest your dollars? You can either spend them on the TFC side of it and keep placing children outside the community and in private agencies, or you can figure out a way to invest in that as a community and help build your capacity in that area. Just something to get on your head and think about. So you've got placements for pregnant or parenting youth. We talked about that earlier. The supervised independent living programs, this is your fostering futures, your extension of foster care to age 21, this General Assembly did back in 2016. My friend Senator Favola over here really was a major champion of that. Qualified residential treatment programs, that's going to be a new term for you. And so that is your residential facilities. So if you're going to use $40, they have to be under a qualified residential treatment program. I'm going to tell you what that is. Then placements for children that have been victims of sex trafficking. And then the last one is placements for children to be able to be placed with their parent while they're going through substance abuse treatment. And the best example I can give you of that is with a substance exposed infant. So if you've got a parent that gives birth to a child that was substance exposed and that parent goes into treatment, there are programs that exist where a child can stay with the parent while they're going through treatment and they can be placed together. We know about 5 of these programs that exist in the state. Currently, none of them meet the requirements under this act. So we're working with those programs to see what we can do when we get those programs. So it's not a new idea, it's just the reimbursement structure is new under this act. Now, what does it mean to be a QRTP? So because in Virginia we believe everybody is best at doing their own piece of this, we do licensing in all these different places, including inside of my department. We do it in 2 different places. We do it under my division and we do it under the Division of Licensing. So if you're a local agency foster home, I oversee that. If you're a private agency, then that is overseen by our Division of Licensing. Why we set that up that way? You got me, all I know is it creates a significant challenge for us as a state of trying to get all these licensing entities saying the same thing and moving through the same process. So you've got, there's Medicaid up there, behavioral health certifies all your psychiatric residential treatment facilities. So these are all your high-end facilities that kids go into, the back end of it. And then in our licensing, we oversee the group homes. So we basically license all your group homes from that. So that's how this structure fits together. So you can imagine what it's like trying to pull all these groups together and get them all moving in the same licensing structure. So we are going around the state and helping facilities figure out how to do this. So once again, there are people who say, what are you doing as a state to help make these changes? We have did a full-on summit this past summer with all the private providers to help them understand about this QRTP designation. What does it look like? How do you get there? We just did a series of webinars last week with those providers going through the certification process. How do you get there? We developed an application, so as a facility, so they can apply for that. Interestingly enough is that as a system, the state has to make a QRTP designation. So that under the act, that is an actual state decision, that is not a federal decision. And so we are working on that. We have intra-agency bi-weekly meetings with Medicaid, with behavioral health, and the Office of Children's Services, trying to make sure we've got all 4 major agencies heading in the same direction. It's the first time in my career that I've seen all of us sitting at the table working together. And I will tell you, part of that came out of our 3-branch work. The providers said we drive you crazy. Providers say, well, you tell me to do one thing, Medicaid tells me to do one thing, CSBs tell me to do one thing. You all need to get it together and come up with a set of recommendations so we know what to work from. And so that's part of the fruit of your labor, seeing all of us at the table trying to do this. In addition to that, we just trained over 600 local agency attorneys and your guardian ad litems, court-appointed counsel, CASA volunteers. We went around the state and did 5 of these sessions, 1 in each of the 5 regions throughout the state. We had over 600 personnel come on with this because part of what everybody tells us is, well, what are you doing with the courts? And so here's what we're doing with the courts to help to make sure the judges understand these changes and what is this going to look like and what are we doing for that kind of thing. So, and I'm not going to go through this a whole lot with you other than just think about we've got to make technology changes. I run a statewide system that we got from Oklahoma for $1 in the 90s. So I think we've got our dollars worth out of our statewide child welfare system for that end of it. But so what I will tell you is it's written in a dead computer language. And what that means for anybody that works in the computer area, it means they don't teach it anymore. So I can't go out and find programmers to program it and that sort of thing. So we've got massive technology changes that we have to make in order to make this happen. We've got to have a 4E prevention plan approved by the feds. That is written and it should be submitted next week, provided the commissioner signs off on it, submits it up to the federal government. We've got to have that in place before we go live with this. So that way we make sure we're in a good place for that end of it, and then all the other pieces that are going along with this, including all the guidance that each of your local communities and departments will need in order to implement these changes. I have now done this presentation over 100 times. So I have done it, been there, done that. I'm going to local communities, I go to local courts, I go to local CPMTs,
that end of it. So we have been literally all over the state helping educate people about this and what is this happening. We spent over 15,000 hours in what I'm telling you today in order to get this piece of it. That is how massive of a change we're talking about as a community. Why I'm telling you that, you're going to have to invest time, effort, and energy and prepare yourself for this change. You can't just sit and go, okay, I heard about that Family First thing, and July 1st it changes. You're going to have to invest time and effort and energy. And I really encourage you to do that in your CPMTs. That's what they exist. That's what they're there for, to make sure that these sort of policy changes are really worked out at your local community. If you want to advocate, I encourage you to advocate for this. It's called the Family First Transition Services Act. This was came out and the bills were filed last week at the federal level. It means that we would get almost $11 million in federal money to help make these changes. It also relaxes that 50% requirement on those well-supported programs I told you about earlier. So if you want to advocate, contact your federal legislators and say, and there's a House version and a Senate version. So I encourage you to reach out to them, and if you just tell them the Family First Transition Services Act, that's what it's known as. I would really appreciate that piece of it, because getting to get that money in will help us make all these changes that we're talking about and ensure that as communities it doesn't impact you in a significant way if you're one of those communities that has not done prevention services. Because if you're one of those communities, it's going to take you some infrastructure and some time in order to get yourself in the prevention arena. So something to think about. Always encourage everybody, if you want to do a 3-branch local team, and bring your leadership together. Whenever I say a 3-branch leadership team, what I'm talking about is bringing leaders together from the community, inside of the judicial side, inside of the executive side, and inside of the legislative side, which this could be your board of supervisors, members, those sorts of things, to be able to talk about these and make some community decisions. The challenge that we see in a lot of jurisdictions is people end up sitting at the table are ones that are not in decision-making authority. And so they go down the route, and then it's not connected to you and your budgets. It's not connected to all those other decisions that you've got to make. And so you need the powers to be sitting at the table. So just encourage you to think through that model. I helped also set on a national group, the National Governors Association, that helped create a toolkit for how to do this. So you can go to the National Governors Association website. It gives you a toolkit for exactly how to look through and do that. So for that end of it, I am a huge transparency person. So if I know it, you're going to know it. So if you go to our website, familyfirstvirginia.com, it has everything I've just told you. It is there. It is listed. I post updates as I get them. We do monthly newsletters. We share everything we've got. So if I know about it, it's available to you to be able to go out and look at that. Also, on the clearinghouse piece of it, if you go to the clearinghouse website, you can link off their Family First website. If you put in your email, you will get an email every single time that a new program is added to the clearinghouse. So you don't have to remember to go back. You don't have to do that. You just have to deal with the emails that come. So depending on from that piece of it. And then certainly here's our Family First website. Reach out to us. Feel free to do that. It's kind of a standard email that will give you the chance to do that on that piece of it. So,
Thank you, Carl.
yeah, no, hold on, I got a couple. I need to connect a couple of things to Senator Favola.
Okay, we're going to transition, but you're going to do the transition.
We're going to transition you over to that piece of it. So, in regards to everything I just told you, we also had a JLARC review of foster care. The JLARC recommendations from foster care are very consistent with what you just heard with the Family First Transition Services Act, and including a major focus on relatives and those 34 recommendations that I mentioned to you earlier. There was a bill that was passed last year, Senate Bill 1339, if you want to go and look at it, that prioritized those set of 34 recommendations for us to move our system forward. At the same time, they directed the Commission on Youth, which Senator Favola chairs, to then continue to work on the foster care system and make a set of recommendations. And so Senator Favola is going to talk through those set of recommendations and really what we're looking at for where the state is going to pick some of this up and move forward. So,
Thank you, Carl.
thanks, Senator.
I want you to listen carefully because I want the state to do everything that I discussed in my recommendations. Thank you for inviting me. It's a pleasure to be back. I was a member of the VACo organization and 10 years on the VACo board, and I was your president-elect, but then I was elected to the state senate. You very nicely asked me to not fulfill my term as president because I would be in the senate. So it's nice to be back. I'll quickly go over some of the recommendations. I'm not going to go over all of them. I'm very anxious to hear your questions or comments. And I think you all are doing the work of angels when you're trying to help our children and provide a meaningful safety net so they can grow up and thrive. So one of the biggest issues that came out of the JLARC study, it was really pretty dramatic, I think, because I did not realize that our family service workers are paid so little. Their caseloads are very high, and we are compromising the quality of care we're providing as a state and at the local level to our most vulnerable children, those who are in our foster care system. So there will be recommendations to increase the salaries of our family workers, family service workers, who are out there monitoring our foster care children, and to also reduce the caseload. So I don't know what the governor will ultimately propose, but I do hope that the department embraces the JLARC studies and moves forward with them. So now I'm going to get to some of the more programmatic issues that the General Assembly is truly going to embrace, because I think they make a difference, but if I'm off base, feel free to just tell me that. You know, a few years ago, through budget language, I actually got language in that created the Fostering Futures program, which allows either a foster family or a foster youth, when a youth reaches the age of 18 and it transitions out of foster care, that youth or a foster family can draw down 4E money as long as the youth agrees to an education program or a workforce training program. So essentially, we're creating a safety net for our young people, former foster youth between the ages of 18 and 21. All the evidence told us that our youth were falling through the cracks. When they graduated from the foster care system, high percentages of our children were homeless, subject to actual human trafficking, oftentimes substance abuse users because of the stresses. It was like post-traumatic stress syndrome, being thrown to the street. So that language passed after 4 years. We were able to draw down 75% of the cost from the federal government, states putting up 25%. Local governments probably have to do a small administrative match on that. But my language was in the budget, and now I'm being told that if the youth decide to go through a JDR court system, or there's a more official infrastructure established for the actual development of the education plan, folks like authorizing language, not budget language, so I have to go back and put that into authorizing language. So I'm not expecting there'll be a lot of trouble doing that, but that's one thing I have to do. 2 years ago, we managed to pass the kinship care or kinship gap program. Again, something I've worked on for a long time. This program was focused on accessing Title IV-E money, but it had a lot of conditions with it, which sometimes happens when you get a federal framework. So the conditions were, if a child entered foster care and the caseworker, as our caseworkers usually do, it's part of the best practice, they try to identify relatives or kin. If a relative or kin is identified and that relative agrees to be a foster care parent for a period of time for 6 months, then once the kin does that training program, if you will, and becomes a foster parent, the child's with the kin for 6 months. They go to a court, they come up with a guardianship agreement for permanency. They call it a permanency agreement, really. They can draw down this 4E money. As it turns out, very few, 3 cases now. So we only have 3 families that have agreed to participate in this. So I'm really upset about it. I understand why, because the child actually literally has to enter the foster care system. And then the relative has to enter the foster care system and go through this planning. So in our state, many of you know, we have got one of the highest diversion programs, I think, in the entire country. So what our caseworkers do is they try to place a child with a family before the child ever enters the foster care system. So I think that's where my legislative energy should go. And we do have some expertise actually in your department. The former Director of Social Services out of Fairfax County, Nanette Bowler, is now our Deputy Director for DSS. And she believes, as Michigan and other states have done, we can create a guardianship program where the foster youth and a relative can be linked together before the foster care system ever intervenes. But a JDR court would come up with a guardianship plan, because you guys are in the business, you know that if somebody is a foster parent, there is a need to have sort of an articulation of where parental rights begin or end, or where they're shared, whatever. So once we get this guardianship agreement through the JDR court, and it would give us the opportunity, a judge could decide if the relative perhaps needed some case services or needed some ongoing monitoring, which might be the case, because many of our relatives who are stepping forward are grandparents or sort of living on the edge themselves financially, and may be in less than stable positions, but they're willing to yet take on a child relative. So we're hoping that this guardianship bill, and I'm still going through all the details, I'm very happy to sit down and talk with you if you have ideas you can help me with this legislation, because it's right now being drafted. Hoping we can get it into play and maybe draw down Family First money, but we're not sure how that would work, if the families would get a monthly stipend. We're gonna talk to you about that, Carl. But that's a way that we want to move forward. We heard from our troops on the ground, from you all, that you would like the ability to have a stipend provided for some of your internship programs that you're actually using in your foster care system. Many of you are hiring students, MSWs, and you don't have any stipends to give them, but they're doing quite a bit of work. So we're going to try to move forward with a program like that. There has been a request coming forward from all of you to set up a kinship navigator system where we can, using the entire country, better be able to identify, relatives or folks who have a relationship with a child, so we can actually create a larger pool of potential kinship placements. So we believe that, again, the infrastructure of technology and a navigator system might be helpful. We're going to ask you to work on that. We'll try to put money in the budget.
That's always appreciated.
Yeah, we'll try. I just have to tell you something, this is an aside. It is incredibly frustrating as we go through our legislative process, when we come up with a bill that has a fiscal impact, in most cases, it gets sent to the governor's budget and planning office, and then of course my finance people, those that staff us in the legislature, look at it. But budgeteers always assume the worst possible case, the most number of children possible would get onto the system as soon as possible. So I get usually this incredibly large impact statement, and I have to go back to them and say, now stop. We're not going to be enrolling 25 kids in 1 year. We're not. If you go back and look at history, we're probably going to enroll 3. Oh, but the potential is 25. I said, well, yes, over 7 or 8 years, perhaps. So we keep going through these battles, and I don't know why I'm sharing it with you, but just to let you know, I have a lot of battles. And they seem to revolve around money, which I guess you all do too. The other thing that's really coming out of the Commission on Youth is, to the degree we can help you, we really want you to be able to recruit foster families, more of them, and to provide support for them. We have a jurisdiction in the Commonwealth, well, Hampton Roads. Anybody here from Hampton Roads? Oh, well, I just want to publicly congratulate you. You don't have any placements in the therapeutic placement setting. Hampton Roads somehow has managed to recruit foster families, and even foster families who can take challenging kids, and you're providing the services necessary. So I believe you're probably ensuring that the children maybe get a better outcome, and you're costing your jurisdiction and the state less. So, so kudos to Hampton Roads, and we really feel that we don't want to be in the position, and sometimes we are, where our foster youth are placed into therapeutic placements simply because there aren't foster families available, and the child could survive in a non-therapeutic setting. In fact, even thrive in a non-therapeutic setting. But we haven't really reached that point, and that's where we want to go. At the end of the day, we want our most vulnerable kids to have a normal, to achieve a normal life, to access services that recognize they've gone through trauma, and that this trauma is normal for the situation they were in. They should not be given psychotropic drugs. They should be given other kinds of behavioral interventions that are not drug dependent. An acknowledgement, again, that they have to transition now from something very traumatic into something we hope will be more normal. And then at the end of the day, our kids can really thrive. So we keep going back to those principles as we go through the mechanics of developing legislation and trying to create a framework that you all can easily access, that you can implement, and that you can make work at the local level. So with that, I will conclude.
Thank you very much. Appreciate the comment from both of you. I've got a question for you right off the bat. I like these initiatives.
Okay, good.
Based on your working with the rest of the legislature, what do you think their chances are?
Oh, well, I don't know, but you know, they say never predict. I think my fostering futures, I'll be able to get the authorizing language through because we already done the budget, we've done the heavy lifting there. I think my guardianship bill is, I'd like to get it authorized even if I can't get money. You're saying no, it's not going to happen. Even if I can't get money, tack on, you say no. But
I think for that conversation, I think probably what you'll get is something to direct us to
A
work
study?
on that. I'm not sure it's necessarily a study, but you're talking about I expect a large fiscal impact, and so it's not planned for, and it's not part of the governor's budget process. And so before Ms. Bowler came in, the department had already identified all their legislative priorities before she joined us in August. So I would say it's going to have to be tempered. So don't expect it to be in the governor's budget, and so you're going to have to.
so that'll be a heavier lift.
Those two things.
Yeah, but I'm still putting it forward because it's sometimes major transformational legislation takes 2 or 3 years because you have to educate lawmakers, we have to educate you. I was with the department. Well, where was I? Wednesday, I was in Newport News, and we were with the Association of State Social Service Directors. I was there in the morning. You came in the afternoon. Yeah. So we were talking about this with all the detail you might expect that a director of social services would want to ask. So I'm pretty determined to at least put the bill in. If I have to turn it into direction, I will, but I want to give you a pretty rigorous framework for that.
We have other questions out here.
Can we ask the gentleman in the back held his question? And he was talking to you when you were doing your slide presentation.
Actually, I had another question. Yeah, I think you got a satisfactory answer out to the first question, or you were on the way. I'm happy to have you talk about that in further detail. One other thing I would like to ask, though, our locality is in Central Virginia. I've been on our CPMT for many years, and one thing we struggle with is private day services that aren't necessarily available in our locality, and so we spend children in our community that spend hours a day on the road to access private day services, which are only offered in maybe Richmond or Charlottesville, et cetera, et cetera. So to the extent that we can offer private day services maybe in our school settings, and I know that's something we'd have to approach with extreme caution, but it would certainly be something that we wouldn't compel children and the people on their IEP teams to do, but to be able to offer that option for many caregivers, for many parents, that might be something they would like, keeping their kids off the road, lowering our costs and the burden we place on our taxpayers. So if we could find a way to do that going forward, I guess that's more of a statement than a question. It's been something we've talked about a lot in the General Assembly, and thank you, Senator Favola, for your efforts on this. But I think going forward, it would present a lot of value for our communities, especially that are further out into the rural areas. So more of a statement than a question. Thank you for giving me the floor for a
That's a
moment.
very useful comment. So any additional information you can give me on that, we would like to consider that.
Be happy to. Thank you.
You mentioned a lot of the interagencies that are involved, mental health, social services. I didn't hear, and maybe I missed it, the role of education, Department of Education, schools. I mean, the county and our school system has an initiative of the whole, learn to read, read to learn by the third grade. And the third grade test scores in Virginia are all declining and declining fast. And we're actually tracking those students 8 years later, that they have the highest dropout rates, they have the highest incarceration rates. They actually may be feeding the next generation of people who
If
are
they're not
declining
reading
secure services. So I don't know, this early childhood learning, the accountability of trying to do it. Maybe students who aren't qualified for an IEP necessarily, which that brings them into the CSA umbrella. But I don't see and hear anything about the importance of getting a child to read, which is a pivotal moment of their life, so that they can then read to learn.
Yeah, we have a whole network on early intervention services that is not part of Family First. So there's a whole early intervention work that's being led by the First Lady. And so we are heavily involved in that. Department of Ed is involved in the Family First work. In addition to that piece of it, we have a designee from the Department of Ed that is part of this from that end of it. They're also part of the CPMT structure and part of CSA, and so they play a pivotal role. They are not inside our secretariat, and they are not inside of the oversight of licensing of the programs that we're talking about today. So that's why you did not see them listed. I said there are over 130 different providers, governmental agencies, and everybody that are involved. I didn't put a list up in this, but they're certainly an integral player and are playing a major role in this and that piece of it. If I took you to visioning out where this would go, eventually we would love for people across the system to be able to get access to these services without coming through the local department. And so DOE has a major role to play in that visioning if we can get there. Right now, the 4E infrastructure only exists inside of local departments, so this has to run through that. But the group wants to be able to get very much like a universal access piece of it, and so DOE is playing a major role in that as well. So there's just a couple ways that they're crossing over in addition to that.
There was a bill, and some of this got into the budget last year, which actually took some of the programs that were in DSS and moved them over under our, her name is Jenna Conway, and I think she's what, the Assistant Superintendent for Childhood Readiness or something like that. And we're trying to piece together money so we can really make universal access to early childhood education a reality. And we're putting our hands on as much federal money as we can when we have flexibility. And we're funding it. If we really did have universal access, especially for our lower income kids, it would be a huge difference, and we believe there'd be savings. There would be perhaps fewer IEPs, we'd be spending less in, the services that go along when you don't have a child reading at the age when they're third grade. So we do believe that is an important criteria. I'm sorry I didn't bring that information with me because it wasn't right in this bailiwick, but we get it.
Carl, I appreciate the effort to have a statewide contract localities to be able to rely on for providers. We struggle finding providers in Warren County. And one of the issues we struggle with is a lot of small providers don't want to get the insurance coverage to name us as an additional insurer. We require a minimum of $1 million of additional coverage. And from the fact that we've had a child in the facility sexually assaulted, I want to make sure, because I'm the board, I want to make sure that we have the adequate insurance protection. So I encourage you in your RFP to make sure that any provider that signs up has adequate insurance coverage, so we don't have to then end up in some negotiating stage with that provider.
Yeah, absolutely. And we've got there are standard amounts, and I'm sorry, I'm not procurement as a specialist, but we've got standard amounts that have to go into every statewide. So I do a lot of contracts, just not for service provision. And so that's really where this is new. I think I now have 215 contracts inside my division alone. So we do a lot of contracting, and there's a lot of standard language that goes into it. But it's a great point, and I'll make sure that ensure that that's covered. So not trying to put it back on anybody, we're trying to get it eased of the
So are some of those state standards going to make it difficult for some of our local providers to be an approved carrier? In other words, for those of us in the middle of nowhere, we don't want to lose the providers that we die
No.
because you've made it difficult for them.
No, it's not. The thing that will be difficult on your provider is whether or not they are certified in the program that we pay for.
Which they should be already.
See, that's what I don't know in your community. I don't know each one of the jurisdictions of what you've got available inside your community and what you don't. And so if you have an FFT provider, FFT, MST, PCIP, if you've got one of those providers that's already in your community and certified to do that, then they should be, we're not adding any additional standard over top of what they're doing from that end of it. We're saying that we are going to do FFT. There is a national body that certifies those for FFT. And if you're an FFT provider, we're going to pay you X amount. So we're getting into a rate setting conversation, which I didn't want to take you through way down that road, rate setting in CSA. So we're going to have a standardized rate that people are going to get and say, if you're going to provide this service, then this is what we're going to pay you, this is what it's going to look like, and you're going to sign on this contract. And so that saves every single jurisdiction having to negotiate a rate, having to negotiate all those different things. The standard contract language, and if you're really into this, you go out to Statewide General Services. There's a website that has all the listings of what our general contract language is. You go out and get into those pieces of it if you have any concern, and then let me know. But the idea is not to create any barriers. The idea is taking those barriers away and being able to get access to services that.
Well, sometimes we create situations that are unintended.
Yeah, but I think what we've heard back from everybody is that we were already creating those unintended by doing it 133 different ways. So as a smaller community, as a rural community, we don't have the access and the numbers to be able to support a program. So can you help create that? So I think it's a great.
I also want to tack on to Christian's comment about day school. We attempted to try to get private day school to come out, even for our whole region, because we have one, and they're incredibly expensive, and we're not satisfied with them. We have no options. There's no competition. I don't know what.
There's a question over there.
Senator Favola, you had mentioned that social workers are overburdened, and you were looking at maybe a raise for them. The
Yes.
Board of Education redid the SOQ policy, and I guess the governor has to look at it.
Correct.
We're looking at probably about $850 million for next year's budget. But one of the requirements was for possibly a social worker in the school system. Then that would settle two things, because you mentioned that you guys are more reactive than proactive. If you had a social worker in the school system, then you would be more on the proactive side of it. You would be interacting more with the children to head them off.
Boy, this is going to sound very bureaucratic. A social worker in the school system would be reporting up through the school system. And the intent, although we use the label social worker, we also use behavioral interventionist, counselors, or other like qualified individuals. The intent was to provide counseling services to the child in a school setting. A school-based social worker would not have the training to intervene, say, in a child protective service situation, or...
Unless they assign one from social services. I mean, we have school resource officers in the school system that are certified deputies, that have arrest privileges different from a school safety officer.
I mean, I would not interfere with however the school system and the Department of Social Services wanted to arrange it. It's just the lines of reporting authority would have to be clear.
Right,
What
right.
the person was
Who do
actually
you work for,
responsible
who do you
to
report
do.
to?
Yeah,
Right.
and the money would flow to the school system.
Right.
So there would be some onus on the superintendent and those accountable for the expenditure of public dollars.
You do have the school representative on the CPMT, which can provide a mechanism for getting children into services. Yes, question.
And then just one more thing before we move off that. What the budget amendment is really targeted at is the beginning salary for a social worker is $29,930 for a 4-year degree required individual. You can't even recruit for the positions, and so part of the budget amendment, we have a 40% turnover rate for those first year. It's trying to, you got to get workers in those positions to be able to do that, and but you're taking it a step further and actually be able to integrate those two from that end of it. So I think here are two different conversations that end up, but definitely well integrated and good conversation.
I could just add that Bedford County has a pilot program doing just that. It's just we're in our first year.
Okay.
So there is
It's
some-
very interesting.
Piggybacking on what the gentleman behind me who's since,
Who's gone?
last week, we had the Northwestern Community Services gentleman talk to our board to educate us, because I've been trying to do this with my board, is emphasize what social services is doing in our county, how it's changed in the last 10 years. So anyway, he went through everything and really impressed everybody, didn't they?
Yes, he did.
He really did. He was an excellent speaker. He's been doing this for years. And at the end, he asked, well, what can we do for you? And then we said, what can we do for you? And he said, transportation, getting the adults and the children to services to Winchester or down the valley or so on. If we could have just 2 rooms somewhere in Berryville where the clients could come and have their treatment or whatever there, instead of putting them in a car and taking them 10,000 miles. You know, if somehow we could work with the local Board of Supervisors to provide a place, you know, a local place where these people could get treatment and not have, and with the transportation cost and just everything would just be really nice for everyone.
So
I'd like,
the local governments could provide that space, or you could use the community.
Is there any way that you could
And
put a
what is
little
the-
pressure on
what is
the
the
Board of Supervisors, or give them some guidance or something, or encourage them, right?
Yes,
Encourage
encourage,
them.
yes.
I think we have time for one more question over here.
So we work in the library system, so how can we help you? We have community rooms that you can use. We do programs that we try to have where parents and children are interacting
Which
together.
jurisdictions?
We're in Botetourt County.
Okay.
But just what else can we do for you in helping you in your recruiting process for foster homes? I mean, we have information on our boards, but I feel like they walk past the board. So what kind of programs, what kind of
Yeah, and so what you're actually finding is the programs that have been really helpful with this is there's an intentional crossover between the public sector, the private sector, the faith-based community, that they are bringing in foster parents that are helping to recruit other foster parents, and then wrapping supports around those foster parents, not just creating foster parents. So finding places that people can support the foster parent by respite care, bringing meals in when they have children, those sort of things. So it's actually much more of a process of not the flyers, those sort of things don't work. Just is exactly what you're saying. It is having an intentional effort by your community, bringing parties to the table that is working across not just the governmental sector that is getting them there. And so we can talk more about that, but we'll have a plan out probably early next year that will lay all these out so a community can do that based on the JLA recommendations and some of the stuff the Commission on Youth is doing. So look for that in early in the year, and you'll see that.
Okay, Senator Favola, Mr. Ayers, I'd like to thank you for being here today, but even more, I would like to thank both of you for what you're doing for the children of Virginia.
Thank you, thank you.
Now, would everybody who